G'day guys, Darcy and Jace here. Today we're talking shoulder function, in particular Jason's, who's terrible at external rotation, okay? And when we're talking about our shoulder, we're generally looking at our pecs, our traps, our rotator cuff. Today we're unveiling a secret muscle, and that's our lat. Did you know that our lat actually attaches into our humerus, so into that bicipital groove? Yeah, so it helps with internal rotation. So when we're talking about Jace, let's turn on our side, Jace, and show them your external rotation. So we should have that further back, yeah? When our lat's really tight, we're gonna be limited in external rotation and flexion, okay? Our lat helps in extension, internal rotation, you show them, Jace, adduction, good. And so essentially, if you're a tennis player, baseball player, somebody who's throwing a lot, or even a runner who's using a lot of the lats to sort of propel them through the air, yeah? You're gonna be limited in that shoulder range if you've got really tight lats and flexion, exactly. So come and show us on the wall, Jace.
All right, it's pretty bad. This is probably the worst shoulder. I'll go one at a time.
Yeah.
That one gets to there. This one gets a bit further, but when I do it double, it's really limited, and my back really wants to arch to try and make up for that.
Yeah.
So
So a true test, Jace should have his back flat against that wall and be able to get his wrist to touch the wall.
Give us a comparison, Dan. Show them how good your shoulders are, mate.
Yeah, I can
show them nice and healthy.
And
shoulders.
even if you can get your feet all the way there, flat back, and then touching.
It makes me feel bad.
Not everybody can do that, and I'll show you exactly if you turn your back over here, Jace, we can talk about the anatomy and where the muscles originate and start. So here's our lat, nice, big, bulky, takes up a huge surface area on our body. So starts into our thoracolumbar fascia, that white connective tissue down here low, into our iliac crest, comes up from T12 to T7, all these spinous processes, and comes out underneath our scapula and into that groove in our bicep there, up under there. So there's lots of points that we like to target. Yeah, we can start in our lower back, we can work into that rib, we can go into that scapula underneath our teres minor. But I'm going to show you a few really important treatment strategies when we're trying to unveil and unlock external rotation, yeah? So we're thinking internal rotation is its joint action, but what is the antagonist to that is that external rotation where Jason is mostly limited. So let's just do a few warm-up strokes. We've got our Myo wax here, something that's not too slippery, right? Something that we can purchase. So Jason's nice and muscly, so we can see over here exactly where his lat starts. So you can start by treating the lower back, but what I like to do is go straight underneath that scapula and work down.
Oh, it already feels good.
Yeah. So we do a lot of pull-ups here in our functional training, rows, deadlifts, even our squats are going to have our lats firing just to sort of keep our shoulder blade in a safe position. So our lats are contributing to a lot of our movement that we're doing, especially as therapists. Like, think of me right now, if I'm bent over like this, how much I'm engaging my lat. So us therapists constantly need our lats treated, and it's often overlooked. As I said, we're looking at treating our pecs, our subscap, our rotator cuffs, our traps, our rhomboids, all these points that we're treating, or other therapists are treating, bodyworkers are treating. So let's have a look at the lats. Let's warm them up, get some blood flow, get some circulation through here. So they cross over that rib as well. So if you have trouble breathing, or your shortness of breath, or you're not taking big deep breaths, you're probably going to feel a little bit more congested and suffocated through that area as well. So tight lats may be interfering with how large of an inhale you can take, yeah? So working down, it is quite sore on you there, Jace.
Yeah, definitely feels tight through there.
So this is probably the larger, bulkier part of the lat, right? So it gets down to a millimeter thick, which is absolutely
pretty
nothing.
thin.
It's nothing. So it's very thin across that section through here and into that thoracolumbar fascia. So we're going to work on where the bulkier part is. Okay, so what I'm going to show you, I'm going to grab Jason's arm. I want some slack, so then I'm going to pinch. Good. And then we're going to like drag it, pull it away.
Oh, yeah. Oh, it's good.
Drag, pull it away. So really opening up. So when we're stretching our lat, we're going into that flexion and external rotation. So those movements that Jason's struggling with and has been for a long time. Good. So a bit of a pin and stretch, play around with the fibers, feel where the adhesions are, where the important points are. Yeah, there's a good one there too.
Yeah. Oh, yeah.
Right there. I'm going to get Jace to hold his hand with the other hand. Yep. And now, if you can. And now try and bring it down and then externally rotate it. Good. So just giving our client something to think about takes his mind off maybe the pain and just have a little go at stretching that out himself. Really good. So this is more of an active release rather than a passive release. Passive would be when I'm holding it. Oh, yeah, it's tough. Good. Do 5 more.
Come on, shoulder.
Come on, shoulder. Get moving. Good. 2 to go. Nice. Brilliant.
Oh, yeah.
All right, and now just relax that for me, Jason. I'm going to work up now. Okay. So you can see his lat definition there, can't you? And serratus, obliques. What we're going to do is just try and take some of the tone out of that tissue. Release that off, and hopefully your shoulder starts to perform and function a whole lot better. Our lats are really important in where our scapula is positioned. So that inferior border, like that lower point of the scapula, is where the lats sort of cross over and attach into as well. And that 3rd and 4th rib, which is quite high up and under there as well. So when we're thinking about scapula and rounded shoulders, and office workers, truck drivers, taxi drivers, people that are really using the front of their body, their scapulas are rounding. Their glenohumeral joint, which is their shoulder joint, is tilting forward, and then they've got discomfort and pain in their shoulders, and they now struggle to use their shoulders in the way that the body's designed to. So our lats are really important. Rowing, lat pull down, pull-ups, if you're a rower, those types of things. So utilizing those exercises are going to help you with the positioning of your shoulder and the mechanics of your shoulder by keeping the scapula neutral, especially for those people those jobs that I listed earlier. And there's far too many sedentary people as well, just on laptops, phones, watching TV, that aren't sitting in a nice position. You might not be right now watching this video, so this may resonate with you. So it's important. First, treat them, clean it out, get some tone out of the tissues, and then activate them and strengthen them as well. So it's just as important. Clean first, build second, live free. That's our motto here. Oh, yeah. So you could see some flicking over here as well.
Oh, it's a good one.
Yeah. Oh. What do you reckon, Jace? Why are your lats feeling so tight? What have you been doing?
I just feel like, probably from years of training, deadlifts, and like you said, pull-ups.
Yeah.
But then I think just locking in my shoulders with work, I'm probably locked in more into that internal rotation position where I'm locked in this way, pushing through my elbow, so my shoulder's always locked in that position, so it never gets exposed to those ranges of external rotation. But it's been something that I've been struggling with for quite a while now. So probably something I could have more, or bring more attention to myself and put more work into.
Yeah, you can actually see here the teres minor and the lat differential underneath that. You can sort of see the definition in Jason's arm. So you can see his scap, you can see his teres minor, you can see how these two tissues underneath work alongside each other. So what can happen is those two muscles become adhesive and sticky to one another, and they lock up, and then you're limited even more into that external rotation. So they're both internal rotators, and they both similarly sort of insert into that spot underneath the arm there in that humerus. intertubular.
Groove, well done, Darcy.
Yeah, I struggle
You got
with
it.
Look at that, just a big plow all the way through. I'm going to do another one, but just go a little bit more lateral on the lat. Yeah. Find those spots. Oh yeah, got some twitching over here, so I'm just going to stick on that spot there. When I see pulsating muscles, twitching muscles, it gives me a really good indication that I'm on a good spot, that I'm actually going to be unraveling some tension and some build-up. I'm probably on a trigger point in the muscle belly, which is all good. But I am working pretty deep here. Like, I'm not breaking his rib, but I'm feeling like I'm working to the level of the rib and then clearing as much of that tension as I can.
You come up to a really good one there. Yeah. Oh, there it is.
Yeah, and just waiting for that release. Good. Just getting into my treatment here, really tuning in, trying to be present. Consider all the little adhesions and blockages, these little speed humps along the way. Get a really good gauge of where Jason's points are. Okay, Jason, let's go flat on your back, face up. What we're going to do is try and hit this area here, right in where the lat actually inserts into. And also sometimes side lying, compressing that person and having that shoulder up in that spot you can't be there for half an hour, 40 minutes. It gets pretty uncomfortable. So get them on their stomach, get them on their back, have a little bit of a play around. But here's a good spot as well. Even that tricep. So I'm sort of hitting two birds with one stone there. See what sort of stuff I can do. Just encouraging that tissue to really glide and flow and move.
Oh.
Yeah?
Yeah, it's
something.
good. Yeah, bit of something in there.
Good.
Oh.
Bit there more.
He knows what he's doing, this fella.
Yeah, I can feel something right there.
Yeah. Oh, I reckon if I try and
Yeah, Jace, you do what you need.
Oh, there it is. Oh, what's that?
Oh, yeah. So a bit of tricep like pinch here, like a pincer grip, but I'm also pushing into his humerus there where that teres and lat insert into. Oh, yeah.
Oh, big click.
What's cool about this is Jason's been limited in this shoulder range for as long as I've known him. So finding these spots like may have been hidden for years, 10 plus years, you know? Jason and I have known each other almost 10 years.
Almost
I think it's
10 years,
I think it's
that's
not. I think
crazy.
it's 9
I think
in
it's
September.
9, yeah.
So 10 next year. It's a long time to be mates and understand each other's bodies and been treating each other and looking out for each other.
Yeah, absolutely.
Having a brother from another mother. Just having a gouge all the way down there. All right, and now what I'm going to do, see that bulky part underneath his armpit there? Subscap's in here, but our lat, again, pinch and open. Nice, it's probably not.
Get up there. Do you want me to move a little bit?
Yeah. Nice. Ninja's just opening up the garage door downstairs.
Yeah, big brrrr. Lots of noise going on, but that's good.
Good, and then what I'm going to do is bring you here and then just let Jace relax a little bit. Now there's nerves that run here, so you need to be careful and delicate with your treatment. Don't be traumatic and push really invasively and firm. Like, you can go firm, but just be a little bit delicate and precise with your treatment. Make sure you are careful underneath this area.
Yeah, if there's any sort of sharp burning sort of sensations, you're probably on a nerve, so just sort of relocate.
Yeah, on a really good spot there.
Yeah.
So just playing around, make it personal to that client, you know, don't just treat everybody the same. Take away some of these treatment ideas and techniques though, give it a go, do it on your partner, do it on yourself, get a foam roller, get a ball, do some self-release, do some stretching. That first test that we did is actually a really good way of just doing some flexibility and mobility work as well. So they're called wall angels, and just try your best to lengthen those tissues and stretch them out.
Yeah, this is going to be a good one there.
Sometimes the shoulder just likes to be rotated in that socket, moved around. Really getting in, not missing anything here, not leaving any stone unturned. Or, yeah,
That's a good one. Yep.
There's a good one, Jace. Good feedback.
We always want the treatment to land in the right spot, don't we? So
Yep.
good feedback's always a
Yep.
good sign that we're hitting the spot. We don't want to be sitting in no man's land where there's no pain or discomfort.
Yeah. Oh.
Oh, now he's getting stuck in.
Yeah, I'm really not letting go here. That's like, just got a big barra up in Darwin. I need to hold on to the bastard.
Reel it in, Darcy. Reel it in.
I've been watching too many shows or reels on
Yeah,
Facebook.
Looking for fishing spots, are you?
Yeah, I'm just fishing in here. Found one. We've been at it all week. Here we go.
Yeah, good one. Oh, boy. Oh.
And just wait for that release. It's going to let go. Yeah, get in there. So I'm just double thumb, really getting a good purchase. And creating some space, like I'm pulling it off the rib cage there.
Oh.
All right, Jason.
Wowza.
Let's have a little move around of it. Show us side on how it feels.
Oh, feels loosey.
Feels
loosey.
good?
Yeah.
Feels good?
Yeah.
All right, let's give it a test. Let's give it a
Gotta
test.
always test. All right, here we go.
Oh, getting close.
It's better than the other
Getting
one.
close. So what I'd be working on too is, you know, you can go to the pecs as well and see what we can do there, lengthening all this out.
Come on. Oh, there we go. Oh, jeez.
Bit of a Chinese burn there, Jason.
Ah, feels good. There we go. If I force it.
Force it, it gets there.
It just needs to get into that range.
Yeah.
Oh.
Look, Jason's had troubled shoulders for a long time. Well, look, his shoulders work fine. The function of them in external rotation isn't quite there. They feel good. It feels like there's more blood flow, more circulation.
Like there's more movement there.
Yeah, good. All right, so if you've got shoulder pain and you're limited in some of your range of motion, or you just want to improve your mechanics in the way you throw, the way you play tennis, the way you swim, the way you row in the gym, whatever it might be, come in. See one of our practitioners. We'll get into your lats. We'll find the hidden gems, and we'll just about fix your shoulder pain. So, beautiful.
Thanks, guys.
See ya.
Bye.